This video presentation covers the basic elements of the development of the male and female reproductive systems. Recall that the development of the urinary and genital systems are closely interwoven, especially during their early stages. Many textbooks describe these collectively as the genitourinary or urogenital system. The descriptive embryology of these systems is quite extensive and is often confusing or frustrating for students. I've spent considerable time boiling down the essentials for you in this presentation. Fortunately, there are parts of this narrative that overlap the material covered in histology and gross anatomy. The key to understanding these many details is to integrate these anatomic subdisciplines as much as you can while studying this topic. This material will come together nicely for you if you do. This list of learning objectives will guide your learning of the content of this presentation. The general outline we will follow in this presentation is indicated on this slide. First, we will describe the early development of the gonads, genital ducts, and external genitalia for both males and females during the first 6 weeks, a period known as the indifferent stage of sexual development. This information is essentially the same for both sexes. Then we will discuss the subsequent development of these structures for the male and female separately. Comparing and contrasting differences and similarities between these structures at the same time becomes too confusing or frustrating for novice learners of this material. At the end, we will describe the descent of the gonads from their origins in the abdomen into the pelvic cavity and perineum. Sprinkled along the way are examples of common developmental anomalies you should be made aware of. The urinary and internal genital systems arise from intermediate mesoderm located along the dorsal body wall. During the 4th week of development, as the embryo undergoes lateral body wall folding, seen on the illustration of the left, the intermediate mesoderm forms bilateral longitudinal columns adjacent to the aorta called the urogenital ridges. The nephrogenic cord is located lateral in this ridge, lateral to the gonadal ridge. It begins to develop before the genital system and gives rise to the kidneys and ureters. The genital or gonadal ridge is located medial to the nephrogenic cord and gives rise to the gonads following migration of primordial germ cells from the umbilical vesicle or yolk sac. These cells follow along the dorsal mesentery from the yolk sac to the gonadal ridges. This slide outlines the general developmental timeline of embryonic sexual development. The genotype or chromosomal sex of an embryo, be it 46XX or 46XY, is determined at fertilization. The period between the 1st and 6th weeks is referred to as the indifferent stage of sexual development. Genetically, female and male embryos have phenotypically similar gonads and external genitalia. By early 7th week, sexual differentiation begins and involves divergent pathways. By the 12th week, characteristic female and male external genitalia can be recognized, though accurate identification of the sex of the embryo by prenatal ultrasound is often delayed until weeks 17 to 20 of pregnancy. Phenotypic differentiation is complete by week 20. This latter process occurs in a sequence beginning with the gonads, then the genital ducts, and finally the primordia of the external genitalia. We move now on to a discussion of the indifferent stage of sexual development. Before the 6th week of development, there is no phenotypic sexual difference between male and female embryos. This period, weeks 1 to 6, is referred to as the indifferent stage of sexual development. Before launching into too many details concerning changes and differences in sexual development, it is important to lay down some key starting points for this differentiation process. The genotype or chromosomal sex of an embryo is determined at fertilization. During the 6th week, primordial germ cells from the yolk sac or umbilical vesicle migrate into the gonadal ridges and cause the overlying dorsal body wall epithelium to proliferate and penetrate the underlying mesenchyme and invest germ cells to form primitive sex cords, as depicted in the rectangular area in the upper illustration. These cords are temporarily connected to the overlying epithelium. During this period, the male and female gonads are indistinguishable, hence the term indifferent gonads. If primordial germ cells fail to reach the ridges, the gonads do not develop. While these events are occurring, a new pair of ducts form in both males and females just lateral to the mesonephric ducts, called the paramesonephric or Mullerian ducts. Since these are similar to both sexes, we refer to them as indifferent genital ducts, as seen in both illustrations. These ducts form by invagination of the epithelium on the anterolateral surface of the urogenital ridges. The funnel-shaped cranial end of the paramesonephric ducts open into the abdominal cavity. They course parallel to the mesonephric ducts before crossing them caudally. Perhaps using the letter M in mesonephric in male will help you remember this, or using the Wolffian duct term signifying alpha male wolf. Here's a spoiler alert. At this point, we can simplify things by stating that the mesonephric duct system predominates in the male, while the paramesonephric duct system predominates in the female. Recall from the video presentation on early embryogenesis that mesoderm did not migrate from the caudal end of the primitive streak into the cloacal membrane, the future site of the anus. In the context of our discussion here, during the 4th week, mesenchyme migrates around the cloacal membrane and form anterior and lateral elevations that subsequently form the external genitalia of both males and females. Paired lateral labioscrotal swellings form the scrotum in males and the labia majora in females. Paired lateral urogenital or urethral folds fuse in males to form the penile urethra, but do not fuse in females, where they become the labia minora. Unpaired anterior elevation at the cranial ends of the labioscrotal and urethral folds called the genital tubercle, or primordial phallus. This elongates to form the penis in the male and clitoris in the female. The external genitalia are indistinguishable at the end of the 6th week, hence the term indifferent external genitalia. We move now onto a discussion of the male reproductive system. Differentiation of the gonads as testes or ovaries begins during the 7th week under the influence of the Y chromosome in males or the lack of a Y chromosome in females. The Y chromosome contains the SRY gene, or the sex-determining region on the Y chromosome, which expresses SRY protein, also known as testis determining factor, or TDF. This factor determines testicular differentiation as well as development of the male genital ducts and associated glands. Embryos in which this gene is not expressed develop as females. TDF is expressed in Sertoli cells, or the somatic support cells of the primitive sex cords in males, which now become known as the testis cords and future seminiferous tubules, as seen in the rectangular boxed areas. The testis cords remain as solid cords of cells until puberty, when they develop lumens and become definitive seminiferous tubules. Their walls consist of Sertoli cells and spermatogonia, or primordial sperm cells. Sertoli cells produce anti-Mullerian hormone, or Mullerian inhibiting substance, which, as the name suggests, suppresses the development of the paramesonephric ducts and causes their regression. Mesenchyme, separating testis cords, differentiates into interstitial cells called Leydig cells. By the 8th week, these cells produce testosterone, which induce differentiation of the mesonephric duct system and the external genitalia. Continuing our discussion of the development of the male genital ducts, some of the deeper lying somatic support cells at the hilum of the testes differentiate and organize into the rete testis. This is an anastomotic network of channels that will connect the testis cords, or the future seminiferous tubules, to the mesonephric ducts, which become the epididymis and ductus deferens. The rete testis also makes contact with some 15 to 20, mesonephric tubules in the degenerating mesonephros. These tubules connect the reedy testis to the proximal portion of the developing epididymis and become the efferent ductules. As development continues, the testis cords lose their connection with the surface epithelium by growth of a dense fibrous layer or capsule of tissue that encloses the testis called the tunica albuginea. The illustration on the right depicts a sagittal view of the developing pelvic region with the caudal end of a mesonephric duct terminating in the posterior wall of the urogenital sinus. 3 accessory sex glands develop in the male: the seminal vesicles, the prostate, and bulbourethral glands. The seminal vesicles form as buds near the distal end of the ductus deferens. That portion of the ductus deferens distal to the ducts of the seminal vesicles become the ejaculatory ducts. These open into the prostatic urethra, or the pelvic portion of the urogenital sinus. The prostate gland forms as endodermal buds or outgrowths from the prostatic urethra into the surrounding mesenchyme. Bulbourethral or Cowper's glands form as endodermal outgrowths from the membranous urethra, which is also derived from the pelvic portion of the urogenital sinus, and these penetrate the surrounding mesenchyme as well. The opening of the bulbourethral glands, however, terminate in the penile urethra at the bulb of the penis. This slide describes further development of the external genitalia in the male from the indifferent stage described earlier. Testosterone produced by the fetal testis promotes elongation of the genital tubercle or phallus to form the shaft and glands of the penis. With this elongation, the urethral folds become pulled forward and border a midline ventral groove called the urethral groove. This groove is continuous posteriorly with the phallic portion of the urogenital sinus. By the end of the 3rd month, the 2 urethral folds fuse, forming the penile or spongy urethra. Subsequent fusion of the surface ectoderm of this midline plane produces the penile raphe, readily discernible on the ventral surface of the postnatal penis. The penile urethra developmentally does not reach the most distal part of the penis, the glans. This most distal portion of the urethra is formed during the 4th month when ectodermal cells from the tip of the glans penetrate inward and form a solid, short epithelial cord. This cord later canalizes to form the external urethral meatus, or external opening of the urethra, and joins the previously formed penile urethra. During the 12th week, septations begin to develop in the ectoderm adjacent to the glans, except along its periphery. This results in the formation of the prepuce, or foreskin. The labial scrotal swellings grow together as well and fuse in the midline to form the scrotal sac. The right and left chambers are separated by the scrotal septum, and the line of fusion of the skin is visible as the scrotal raphe. Occasionally, the urethra does not open at the tip of the penis, but rather at some midline site along the ventral surface of the penis. This congenital disorder is known as hypospadias and affects about 1 in every 250 males at birth. It is the most common defect of the penis. It occurs when the urethral folds fail to completely fuse, resulting in the external urethral opening onto the ventral surface of the penis. This opening may occur anywhere from the glans to the scrotum. These require surgical treatment. We now move to the development of the female reproductive system. We begin with the development of the ovaries and the female genital ducts with schematics on the upper right showing a right urogenital ridge and the developing ovary and its paramesonephric duct system. As in the male, differentiation of the gonads as ovaries begins during the 7th week. In female embryos with an XX sex chromosome complement and no Y chromosome, the somatic support cells derived from the body wall epithelium differentiate into follicle cells. These cells surround the oocytes to form primary follicles. The primary follicles become organized near the outer cortical region of the ovary. Because the mesonephric duct system requires testosterone for its development, mesonephric ducts and tubules rapidly degenerate in the female except for a few tiny remnants. The paramesonephric ducts remain uninhibited and under the influence of estrogen form the uterine tubes, the uterus, and upper portion of the vagina. The cranial portions of the paramesonephric ducts are open and communicate with the abdominal cavity to receive future ovulated oocytes. Each ends as a funnel-shaped infundibulum with fimbria bordering its orifice. The caudal portions fuse to form a single-lumen uterovaginal canal. Further details of uterine development are provided on the next slide. Descent of the ovaries from the abdominal cavity to the pelvic cavity causes the paramesonephric ducts to move toward each other in the midline. In so doing, the urogenital ridges come to lie in a transverse plane. Subsequent fusion of the caudal portions of the ducts forms a uterus and establishes a broad fold of peritoneum that connects the uterine tubes and body of the uterus to the lateral pelvic walls as the broad ligament of the uterus. In this translocation, the ovaries come to lie on the posterior border of this ligament. The broad ligament now divides the pelvic cavity into a uterovesical pouch anteriorly and a uterorectal pouch posteriorly. The fused caudal tips of the paramesonephric ducts or uterovaginal canal make contact with the posterior wall of the urogenital sinus, causing it to thicken as the sinus tubercle. Proliferation of tissue from the urogenital sinus increases the distance between the uterus and the sinus. Canalization of this tissue by the 5th month establishes continuity of the upper portion of the vagina with the lower portion. The opening of the vagina remains temporarily closed by a thin tissue plate called the hymen until perinatal life, when openings appear in it. Thus, the vagina has a dual origin of paramesonephric duct and urogenital sinus. Most anomalies of uterine and vaginal development either occur because of abnormal fusion of the caudal portion of the paramesonephric duct, failure of one of the paramesonephric ducts to form, or incomplete canalization of the vagina. This slide depicts several examples of impaired development. Illustration A is a normal view. Illustrations B and C show a double uterus with or without a double vagina. These occur when there is a complete lack of fusion of the paramesonephric ducts. In C, fusion of the tips of the paramesonephric ducts was complete to form a single vagina. Illustration D shows a bicornuate or two-horned uterus. This occurs when there is partial fusion of the paramesonephric ducts and the uterine cavity has two chambers. Illustration E shows a bicornuate uterus with a rudimentary horn. In this case, one of the paramesonephric ducts is arrested in its growth and fails to fuse with the opposite duct. Illustration F shows a septate uterus where the right and left paramesonephric ducts have normally fused, but their medial walls completely failed to resorb, resulting in a septum dividing the uterus in half. Finally, illustration G shows a unicornuate uterus. This occurs when only one paramesonephric duct forms. This results then in a uterus with only one uterine tube. This slide describes further development of the external genitalia in the female from the indifferent stage described earlier. Estrogens stimulate development of the external genitalia of the female. The genital tubercle elongates slightly to form the clitoris. The urethral folds do not fuse and develop into the labia minora. Likewise, the labioscrotal swellings enlarge, do not fuse. and become the labia majora. The urethral groove, bounded by the labia minora, forms the vestibule of the vagina. The remaining few slides describes the descent of the gonads. Here you will find a lot of carryover with the gross anatomy of the anterior abdominal wall and inguinal canal. Integrate this embryology with your study of that material. The testes develop retroperitoneally in the upper abdominal region. Their descent involves passage through the layers of the abdominal wall to enter the scrotum. You'll learn these layers and dissect them in the cadaver lab. The layers traversed represent the inguinal canal, which has an internal opening called the deep inguinal ring and an external opening called the superficial inguinal ring, as seen in the upper illustration. What controls testicular descent is not well known, but involves growth and activities of the gubernaculum and intra-abdominal pressures due to organ growth. The gubernaculum is a ligamentous structure that attaches to the inferior pole of the testis cranially and the labial scrotal swelling caudally. It guides the migration of the testis through the inguinal canal. As the testes enter the deep inguinal ring, they produce an evagination of peritoneum called the vaginal process or process vaginalis that accompanies the testis into the scrotum. During passage through and out of the inguinal canal, the testis carries with it its spermatic cord, which represents its nerve and blood supply and lymphatic drainage. These all originate from the posterior abdominal wall. In addition, the testis and spermatic cord assume fascial coverings for most of the muscles and tissues traversed, except the transversus abdominis muscle. By the 9th month of development, the testes normally have entered the scrotal sac and are attached to its floor by the scrotal ligament, a short remnant of the gubernaculum. Within the first year of life, most of the processus vaginalis becomes obliterated and disappears, except for the portion that encloses most of the testis as the tunica vaginalis. Should the processus vaginalis remain patent, the potential exists for a loop of intestine to herniate into it, producing an indirect inguinal hernia, as seen in C in the lower illustration. Occasionally, remnants of the processus remain that may fill and enlarge with fluid to form a testicular hydrocele, as seen in illustration B. Cryptorchidism, or undescended testicle, is a condition where one or both testes fail to enter the scrotum by the time of birth. This has a male incidence of 1 to 4% in newborns. Patients with this have higher risk for sterility or developing testicular cancer, as the temperature of the undescended testis is about 3 to 5 degrees higher than temperatures in the scrotum. The effective testis is usually surgically brought down within the first year of life. The story concerning the descent of the ovaries is considerably less complicated than for the male. They too develop retroperitoneally in the upper abdominal region. The female gubernaculum attaches cranially to the ovary and becomes attached to the paramesonephric ducts. The caudal end follows a similar course as that of the male through the inguinal canal, the two rings, and then attaches to the labia majora. As the paramesonephric ducts move toward each other in the midline, the gubernaculum pulls the ovaries so that they come to lie on the posterior border of the broad ligament of the uterus. The female gubernaculum does not shorten much. That portion that extends from the ovary to the lateral border of the uterus is the round ligament of the ovary, or ovarian ligament. That portion that extends forward from the uterus to the labia majora is called the round ligament of the uterus. This ends this presentation on the development of the male and female reproductive systems. As I mentioned earlier, earnest study of this material will reinforce what you learn in the histology and gross anatomy of this system. Good luck with your studies.